Good morning. Thank you everyone for coming to Atlanta. I'm Kristina, one of the pediatric endocrinologists here from Children's Healthcare of Atlanta. So I want to give us a brief overview of where we are in Georgia and where we have our outreach locations for our patients. So as you can see, Georgia is in the upper central part of the state. And I zoomed in on Atlanta to show you our 3 pediatric hospitals that we have. The main one is the one in the middle. That's our Arthur M. Blank, our new hospital that was built last year. We have Scottish Rite north of the city, and then we have Hughes Spalding associated with Grady Hospital in the center of the city. Our new hospital, Arthur M. Blank, holds about 450 inpatient beds and a very large emergency room of 69 patients, which I still get lost in. Scottish Rite has 300, and Hughes Spalding is more of an outpatient urgent care emergency care center with a small inpatient bed population. All of these are our Children's Healthcare of Atlanta providers service. The teaching hospital is the Arthur M. Blank Hospital, so it's run by Emory and Children's Healthcare of Atlanta doctors. So we have 7 outreach locations around Atlanta. As you can see, the 3 stars kind of in the Atlanta area are Hughes Spalding, Arthur M. Blank, and Scottish Rite. And then we have a few kind of north and east of the city. We have 22 MDs, 1 PA, 7 NPs. I keep forgetting how big we are, and we keep growing. We hired 2 new doctors this year. We have 8 inpatient diabetes educators and 13 outpatient diabetes educators, so we're very privileged to have this large team supporting our patients. We do have 11 nurses, 3 social workers, 1 dedicated to outpatient high-risk kids, 1 nutritionist, and 2 endocrine psychologists, and we do have a trainer who comes in for our type 2 clinic. So we have a very robust group taking care of our patients. So in the last year, we saw about 3,300 patients with type 1 diabetes, and about a tenth of them are new onset. We have about almost 1,000 kids with type 2 diabetes, and we have anywhere from like 120 to 180 new onsets every year. We have a majority of our patients with type 2 diabetes using public insurance, and it's almost split 50-50 with public and private for our type 1 patients. In addition to type 1 care, we have a type 1 predisposition clinic, a bone clinic, thyroid cancer, brain tumor, survivor, differences in sexual development, Strong for Life, which is our weight management clinic, to George Lipid's Turner's and CFRD. So we have a very large, wide-reaching group here. I wanted to say thank you for coming, and you'll be hearing from my friend Maximus later today. He's one of our children's Miracle Children this year, and he's going to give us his perspective on his care here in Atlanta and Children's Healthcare of Atlanta. Do I hit play? We have a video of our walkthrough through clinic because we can't shut down clinic for the day, but we're going to have you kind of see what our patients get to do every time they come into clinic, if it works. I think they're working on it. Georgia, did you want to come introduce Grady? I don't know if our video is going to work. I know, we worked really hard on it. But Dr. Davis is going to come talk about Grady in the meantime. Just making it work. I'll just stand up. I think we're still working on it. No?
In the interest of time, I don't have that many slides actually, so we can hopefully see that video, but I'm Georgia Davis. Welcome to Atlanta, like Kristina said. I'm one of the endocrinologists over at Grady. Once we have some slides, we can talk about Grady, but Grady is our public hospital here in Atlanta. Excuse me. I feel like it truly is the heart and the cornerstone of care in the city. It's been here over 130 years and provides care to anyone, regardless of background or ability to pay for that care. So we are the largest, one of the largest safety net healthcare systems in the country. And we have a large main hospital, Grady Memorial Hospital, down in downtown Atlanta, but we are also growing. And I think I have slides. I can see them. Which one sends it forward? This giant green arrow forward is the forward slide. But this is one of the main buildings of our hospital. It's one of the only level 1 trauma centers here in Atlanta. And we are proud of that. In addition to the main campus in downtown, we are expanding, which we are also proud of. We have many satellite clinics that provide primary care and some specialty care, and we are a recognized center of excellence for certain things like the Trauma Center, Burn Center, the Stroke and Neuroscience Center, and also infectious disease care. The Grady Diabetes Center exists on the main campus, so the only specialty diabetes care for Grady with endocrinology. Oh, I hit forward, but it looks like it's not advanced yet. Is that good? Okay. No? Okay. So I can only see this here, but the Specialty Diabetes Center is only on main campus. We are working hard to rival Kristina's team, but we are not there yet. For the adult side, we are 9 endocrinologists currently, 2 clinical pharmacists, 1 nurse practitioner, our 2 RD CDCES, 3 nurses right now, 5 amazing MAs, 2 inpatient CDCES, and we also have some other capabilities in clinic. We do retinal imaging there. We're working on transitions of inpatient care. So we're really working to grow and provide those same services in the adult population that we see for our children through the CHOA system. Within our center, we've worked hard to make this type 1 diabetes clinic dedicated to type 1 diabetes care, which I know I've presented to many of you in this room. It is still growing. We are 2 dedicated endocrinologists to that clinic, 1 clinical pharmacist, CDCES, 1 RD CDCES, a nurse, and a patient navigator now, and they are all sitting right there. So we're really excited to be here. We also have wonderful podiatry services, integrating foot care and wound care into the clinic. It's localized in the same area of our diabetes center, so that's been really great for care continuity. And we've expanded to have now 4 podiatrists working with us. Our clinic statistics, I struggled to put this together a little bit. We see a lot of patients. In the last year, we had 7,000 patients with type 1, type 2 diabetes seen within our clinic. And right now, in the 10 months of 2025, we are already at 6,500, almost 6,600. I parsed it out a little bit, so we have some data from the unique patient visits and encounters from our portal in the QI database, and we had 190 visits in our specialty type 1 clinic in the past year. So it may not seem like a lot, but those visits take time. We were doing about 1 to 1.5 clinic days per month at that point, and we've expanded to 4 clinic days per month this year, and we're already at almost 400 patient visits. So we are working to expand. It is happening, and we're really excited. Grady is growing and updating in terms of how it looks as well. We've had a lot of construction. We are really proud of the work that we've done to improve care and access to technology for our patients with type 1. Just wanted to highlight this for our QI data. Over the past year, we've seen a decrease in our median A1C. So I know these are sort of discrete time points for months, but that trend overall has really gone down. Our median A1C starting at 9.6%, which is not where we want to be, down to 8.3 as of May. We have, increased our services, have a patient navigator, and we're seeing an increase in tech use. You can see that the proportion of patients is on a downtrend for those who have an A1C greater than 9, which is absolutely what we want to see, and a trend up in those who are achieving the goal metric of an A1C less than 7. We also really try to integrate our research endeavors within our clinic infrastructure. So I just wanted to highlight a couple. I think we're familiar with the type 1 infrastructure that we're doing. We have a program navigator grant, which is what allows us to have our navigator within the team for now. We've also established a patient registry, so along to sort of complement that QA data that we can get from the EHR, we have more surveys, a little bit deeper understanding from patients about other things, including diabetes, distress, sustained technology use, and feelings about other care aspects of type 1 diabetes. We also have a study that is looking at an integrated mental health support care model, our team over here. So that's something we're very excited about. I think we all appreciate that care is needed, and then we're always happy to be part of the QI initiative here. We also have an interdisciplinary study looking at diabetic foot wound care and navigating those services from one of our other endocrinologists within the clinic, and they're providing that. It's funded by NIH, NIDDK, and same with inpatient diabetes management, making sure that we're looking at all aspects of care, type 1 and type 2 diabetes, and can we use technology to improve inpatient care, which is, I know, something we often struggle with, and that's funded as one of Dr. Pascal's study by NIDDK. So we're excited to be here, excited to learn, excited to see everyone and familiar faces. This is our team. I don't think they knew I was going to put pictures, but here they are. And please come say hi to us. We're all sitting up here and really excited for today. Thank you.
Thank you, Grady team.